It's Thursday, March 11. This is the news on PBCJ. I'm Simone Absalom Gale. As was reported, Jamaica's vaccination drive began on Tuesday, March 10. The 50,000 doses of COVID-19 AstraZeneca vaccines will be administered across some 18 centers island-wide. Our news team visited one of those vaccination centers at the Princess Margaret Hospital in St. Thomas.
Frontline healthcare workers are first in line to receive the COVID-19 vaccines in Phase 1 of the rollout plan. On Wednesday, the process kicked off in the eastern end of the island in St. Thomas with the Princess Margaret Hospital at the epicenter. Medical Officer of Health for the parish, Dr. Doyen Smith, explains.
The St. Thomas Health Services have commenced vaccination with the COVID-19 vaccine today of its healthcare staff, both primary care and secondary care, meaning the Princess Margaret Hospital is today day one, and we will continue on with the St. Thomas Health Department staff. As such, we have started 7 o'clock this morning with the teams. We've had a number of persons come in so far. We've had different categories come in. Our doctors have come in, we've had our public health nurses, we've had our registered nurses, we've had our orderlies, our attendants, we've had our patient care assistants coming. And so the entire team is coming in, but we're having it at slow points. So we have staggered them, and over the period of today to Friday, we should have everybody completed that is willing to take the vaccine.
When our news team visited, we saw healthcare staff being processed and screened to get their shots. The staff was positive about the experience and used the opportunity to appeal to others who may be hesitant.
I am one of the many frontline workers here at the Princess Margaret Hospital, and ever since I heard about the coming of the vaccine, I see it as one of our salvation to this crisis, this pandemic we are in. And I think it is a very good thing. I am the second person to have taken the vaccine, and I have no adverse reaction. And I feel good about the vaccine.
I took the vaccine and the experience was good. The injection was not painful, and I'm encouraging everyone to be a part of this campaign to lessen the impact of COVID so that we can move forward for a normal life.
Health Minister Dr. Christopher Tufton and Member of Parliament for Eastern St. Thomas, Dr. Michelle Charles, were on hand to witness the inoculations.
Here at Princess Margaret, and she has agreed for us to stand around her to witness the vaccine. So with her permission, we have given you a demo. And what does she have to say about the vaccine?
It's not painful, just a little bite. So I would encourage others to take the vaccine to develop your immunity against this virus and to protect your family and the general public, and continue to sanitize, wear a mask and social distance.
There are some 18 to 20 vaccination centers across the island. Minister Tufton will visit 3 such locations today, Thursday, March 11. They are the Spanish Town Hospital in St. Catherine, the St. Jago Health Center also in St. Catherine, and the Maypen Hospital in Clarendon. For the news on PBCJ, I'm Gabrielle Thompson.
Jamaicans aged 60 and over who are not in receipt of a paycheck or a pension greater than $1.5 million per annum are set to benefit from the government's conditional cash transfer for the Vaccinated sub-program. Details of the program were announced by Minister of Finance and Public Service Dr. Nigel Clark as he opened the 2021-2022 budget debate in the House of Representatives on Tuesday.
And who have been vaccinated as evidenced by the records of the Ministry of Health. So, Madam Speaker, there is public interest.
It's a conditional cash transfer.
Madam Speaker, there is public interest in ensuring that the vulnerable population is vaccinated. And we also want to ensure that all the persons who cannot take up the work opportunities available on the Serve Jamaica program and otherwise are not a part of, have no formal income, receive a grant. Madam Speaker, we expect in excess of 100,000 Jamaicans to benefit from this CCTV program. And the benefit will be 10,000 Jamaican dollars, Madam Speaker.
$6 billion has been allocated for Jamaica's vaccination program. Minister of Finance and Public Service, Dr. Nigel Clark, explained how the funds would be used at a press conference on Thursday morning.
Is to be used for the procurement of vaccines, to actually purchase vaccines from suppliers, as well as the storage of vaccines. You know, the vaccines have to be stored under specific circumstances, as well as the distribution of vaccines. The Ministry of Health has announced many sites across Jamaica, including health centers where vaccination can take place. That comes with attendant costs, you know, preparing those sites and providing ancillary services to those sites. And of course, the administration. There's a computer system that has to be procured, software, storage, data management, etc. So that is to cover all of those costs, and also to make room for the possibility that prices could increase over time. So we are, again, planning for tomorrow, as I said in my presentation, and trying to cover the possibilities, and therefore providing, $6 billion, which should be more than sort of adequate to cover us over the course of the year in order to attain levels of vaccination that are consistent with herd immunity.
Jamaica is one of the most violent countries in the world, with homicides averaging 1,500 annually. But how do Jamaicans perceive their safety? That's where the 2019 Jamaica National Crime Victimization Report comes in. The report is spearheaded by the Statistical Institute of Jamaica, STATIN, along with the National Security Ministry. The report focuses on crime from the victim's perspective, with a view to gain insights that can guide policy and strategies to tackle crime. A virtual stakeholders decimation and press briefing on the report was held on Wednesday.
One of the best ways to solve an issue is to understand it. Statistic is one road to understanding crime, a point made by Permanent Secretary in the National Security Ministry, Courtney Williams.
The Jamaica National Crime Victimization Survey, it allows the Ministry of National Security to better understand people's views of safety in their communities and more broadly in the country, while providing useful insights into their confidence in law enforcement agencies. It also provides information on the socio-demographic background of victims.
According to the 2019 Crime Victimization Report, Jamaicans felt mostly safer walking in their communities at day rather than in the nighttime. This was one of the several findings presented at the virtual press brief by STATIN Special Projects Unit Head Philone Montauk.
Now, the data shows that persons generally felt safer walking alone in their community. And when we say community, the community that they reside in the day than at the night. So 9 out of every 10 persons, 91%, they felt safe walking in their community alone during the day, compared to almost 7 of every 10 persons who felt safe walking alone in the night. So that's 69.6%.
The report also looked at the percentage of crimes that occurred at home, as well as by those experienced by individuals.
All respondents to the survey, 16 years and older, were asked if they had been a victim of each of the core crimes between the period September 2016 to August 2019. And we did that to ascertain the level of victimization over the past 3 years. Now, of the approximately 897,800 households in Jamaica, 9%, or it works out to 80,638 households, experienced a household crime between September 2016 to August 2019. In terms of individual victimization, 22%, or 462,551 Jamaicans were victims of a personal crime over the same period.
This is the country's 5th crime victimization report, with the first being done in 2006. Melvin Pennant, PBCJ News.
The average age for initial cannabis use is 13 years old. That data was shared by Minister of State in the Ministry of Health and Wellness, Juliet Cuthbert-Flynn, while making her contribution to the National Council on Drug Abuse's launch of its Good Ganja Sense campaign. It is slated to run from March to December 2021 and aims to increase public awareness of the uses and effects of marijuana. The state minister says, according to research findings, 1 in 5 persons who use ganja is at risk of developing an addiction to the drug.
The 2016 National Drug Prevalence Survey found that 16% of the general population, ages 12 to 65 years, currently smoke ganja, while some 30% smoke it at some point in their lifetime. A quarter of the population reported using ganja in tea. And I think a lot of persons, especially in the country here, would know more about that.
She explains the reason behind NCDA's bid to educate the populace about the implications of decriminalizing ganja.
It is also necessary to pay keen attention to our understanding of the legal context and changing attitudes towards ganja. A study conducted in the late 2020 among 500 Jamaicans aged 18 to 55 years in 6 parishes found that only 18% of the respondents could accurately explain what decriminalization means, while almost 50% incorrectly thought that it now legalized, and you will no longer be arrested or charged for it. Hence, the need for good ganja sense for this campaign.
Mrs. Cuthbert-Flynn says 50% of the survey participants disagree with adolescent smoking, recognizing the risk of addiction and the effects on the brain. She also notes the positive uses of ganja.
With this campaign, the NCDA will become an important source of information on ganja for Jamaicans, the truth affirmed and the myths dispelled. In 2015, the Jamaican government passed the Dangerous Drug Amendment Act that decriminalized ganja use and created an environment that supported medicinal use, research, and development.
The campaign targets parents, youth, community leaders, and groups, among others. The initiative is also seeking to create and strengthen an alliance among key national organizations, interest groups, and civil society organizations in the thrust to increase ganja literacy in Jamaica. Mayor of Kingston, Senator Councillor Delroy Williams, says aid will be given to persons affected by the recent fire on Beeston Street in downtown Kingston.
We are awaiting the advice of the fire department because, the fire department has to give clearance for us to go there. And so we are waiting on that. Then we'll have a visit, and our department, Poor Relief Department, has responsibility for such things in terms of they do offer assistance to persons who are affected in that way, and they have started to gather their information. But I myself will visit there. I know the councillor, Donovan Samuels, has already been there and communicated with the persons affected. So it's something that we intend to guide the persons and to give whatever assistance, also along with the Member of Parliament, the Honourable Desmond Mackenzie.
30 persons are now homeless as a result of the blaze early Monday morning. 3 units from the York Park, Trenchtown, and Rollington Town stations responded. An investigation is underway to determine the cause of the blaze, which destroyed the houses within the tenement. GraceKennedy has come to an agreement with Bliss Limited and Unibev Limited to acquire the 876 Spring Water brand. 876 Spring Water has been distributed by World Brands Limited, a GraceKennedy subsidiary, since it entered the market in 2017. This is the second announcement of an acquisition by GraceKennedy this week. Commenting on the latest move, Group CEO Don Webby stated, quote, "Brand acquisition is a key component of the growth strategy of our foods division," end quote. 876 is marketed as a perfectly alkaline spring water bottled straight from the source in Jamaica's Blue Mountains. GraceKennedy's 2020 financial results showed the group's Jamaican food distribution business displaying strong growth in both revenue and pre-tax profit, coupled with improved operating margins. Under the acquisition agreement, GraceKennedy will assume ownership of the 876 brand, while Unibev will continue to manufacture the product. To find out about the latest gas prices and other market updates, we go to the business desk for this quick report from Gabriel Thompson.
New taxes.
No new taxes for the fourth consecutive fiscal year. Minister of Finance and the Public Service Dr. Nigel Clark made the announcement Tuesday as he made his opening presentation in the 2021-2022 budget debate in the House of Representatives.
We are prioritizing economic recovery, which we want to achieve in the quickest possible time. Increases taxes at this time would run counter to that objective. Madam Speaker, this is the 6th consecutive fiscal year where, on a net basis, we have not raised taxes.
This move comes despite a projected $70 billion hit to revenue as a result of the ongoing coronavirus pandemic. The estimates of expenditure for the fiscal year beginning April 1 total $830.8 billion. Of this amount, $60 billion has been set aside for the Social and Economic Recovery and Vaccine Program SERVE, which Dr. Clark says is designed to boost social and economic recovery.
It will consist of $10.5 billion in special resources for the Ministry of Health, including $6 billion for the procurement, storage, and distribution and administration of vaccines, and $1 billion for personal protective gear, $1 billion for drugs and reagents, and $2 billion for regional health authorities to pay arrears to suppliers that I alluded to earlier.
The program's $31.1 billion allocation to upgrading the island's physical infrastructure represents the largest such allocation tabled by any government in Jamaica's history.
It will consist of $17.7 billion allocated to the Southern Coastal Highway Improvement Project under the Ministry of Economic Growth and Job Creation. And this allocation will allow infrastructural improvements on the roadway between Harbourview and Yallas, and the construction of a new toll road between Maypen in Clarendon and Williamsfield in Manchester. $8 billion is being allocated to the Special Public Investment Infrastructure Program to improve the productivity, increase resilience with installation of drains and water and wastewater and sewage infrastructure.
The SERVE program is to boost business with the provision of $5 billion for micro, small, and medium-sized businesses. This includes $1 billion to assist with digital transitions, $1.7 billion for production incentives to farmers, and continued rehabilitations of roads in rural farming communities. The program will also provide $1.8 billion to boost Wi-Fi connectivity across the country, particularly in rural areas, and $300 million for a Paint the City project, which intends to beautify and upgrade select town centers across the island. Dr. Clark also announced that the customs administrative fee of $3,000 is to be abolished for export shipments under $500 and disclosed the plans to repeal and replace the Customs Act. He also addressed calls for an increase of the customs duty-free limit. The trade in goods and services represents in excess of 70% of Jamaica's gross domestic product.
Now, there have been many calls for this threshold to be increased once again. The effect would be that Jamaicans could import higher valued items without duties and taxes being levied on them. My fellow Jamaicans, I understand the request, but at this time, when the government's revenues have fallen precipitously, when we're still in the grip of the pandemic and risk remains elevated, where the government is dependent on a one-off dividend of $33 billion to take us through the upcoming fiscal year, and we won't have this revenue next year, it would be unwise to erode our revenue base with such a move. It's unwise because, one, Jamaica is tightly squeezed and we can barely afford to sacrifice even the smallest revenue amounts at this point. It could make our domestic wholesale and retail trade uncompetitive, threatening jobs and economic growth at a time we need it most.
And the Finance Minister also announced that effective April 1, the Students' Loan Bureau will remove the need for 2 guarantors, requiring only 1 instead. The budget debate will continue in the House of Representatives on Thursday, with opposition spokesman on finance Julian Robinson making his statement. According to the latest ex-refinery costs from state-owned oil refinery Petrojam, motorists should see an increase at the pumps in the prices of gasoline and diesel effective Thursday, March 11. Following an increase of $2.50 each, 87 and 90 octane gasoline will be sold for $135.56 and $138.39 per liter respectively. Automotive diesel fuel will be sold for $130.18 per liter, following an increase of $1.35, while ultra-low sulfur diesel is up by 57 cents and will be sold for $134.40 per liter. Meanwhile, kerosene saw a price decrease of 20 cents and will be sold for $104.54 per liter. Propane liquid petroleum will be sold for $58.98 per liter, down by 5 cents, and butane liquid petroleum will be sold for $58.75 per liter after an increase of 20 cents. Expect price changes as marketing companies and retailers will add their respective markup to these prices. In Wednesday's trading session, the JSE Combined Index declined by 625 points to close at under 400,000 units. Overall, market activity resulted from trading in 84 stocks, of which 36 advanced, 38 declined, and 10 traded firm. The Junior Market Index declined by 8 points to close at under 3,000 units. Stocks advanced for 1834 Investments Limited, AMG Packaging and Paper Company, and Barita Investments Limited. Stocks declined for Berger Paints Jamaica, Blue Power Group Limited, and CAC 2000 Limited. Trading firm were 138 Student Living, Variable Preference, Community and Workers of Jamaica, and Dolphin Cove Limited. Trans-Jamaican Highway Limited was the volume leader with 2.9 million units, followed by Mailpack Group Limited with 1.9 million units and Wigton Wind Farm Limited ordinary shares with 1.8 million units. In foreign exchange trading for Wednesday, March 10, the US dollar ended trading at $148.54. The Canadian dollar sold for an average $118.97. The pound sterling traded for $204.28, and the euro ended trading at $179.18. Crude oil prices rose on Thursday as vaccine rollouts bolstered the economic outlook, and U.S. fuel stocks fell sharply, although gains were capped by a surge in crude oil inventories after last month's Texas storm. Brent crude futures rose $1.04 to $68.94 a barrel. West Texas Intermediate crude futures gained $1.02 to $65.46 a barrel. And on that note, we close this Thursday edition of the Business Report on PBCJ. I'm Gabrielle Thompson.
In news from the region, 3 months into the new year, and private early childhood institutions in St. Lucia continue to flounder due to the closure of all schools and an uncertain future. The question is now being asked, is there anything in place for the struggling early childhood sector? We have the details in this report.
The early childhood sector continues to feel the financial burden of having their doors closed during the pandemic. SLP Choiseul Saltibus hopeful and former education officer Dr. Pauline Antoine Prosper believes the NAECP has been hard done and deserves attention.
Our young generation has not got an opportunity to get a start. We have to nurture those children so that they are ready for the education, for formal education. And I know the concern of the teachers because they themselves have not been able to make a livelihood because the schools have not been allowed to open. On the front of parents, I have met a number of parents on the ground who need somewhere to put their children.
This week, Newsforce was reliably informed that the members of the early childhood sector were scheduled to meet the permanent secretary in the Ministry for Education and the Chief Education Officer to discuss the way forward for the sector.
The administrators have been clamoring, the employees have been at home doing nothing, they themselves have responsibilities. We know how difficult it is in these days, so I'm hoping that some good sense will prevail and there will be an amicable solution to the problem today.
A number of institutions made huge financial investments in the sector ahead of the 2021 reopening of school to ensure compliance with COVID-19 regulations. However, learning institutions at all levels had to close their doors mere days after the resumption of face-to-face classes, following mounting calls to suspend in-person instruction amid concerns over the post-Christmas spike in COVID-19 cases. Attempts by Newsforce to gain further insight on the talks held between education officials and the NAECP before news time were unsuccessful. Solange Alford, HTS Newsforce.
In Trinidad and Tobago, the trade union fraternity has united to collectively withdraw from the National Tripartite Advisory Council with immediate effect. The announcement was made to the media on Wednesday by the three federations that make up the sector. Terry-Ann Brown-Campbell has more in this report.
Union leaders representing the country's national federations, the Joint Trade Union Movement, the Federation of Independent Trade Unions, and the National Trade Union Center on Wednesday indicated that they will immediately step down from the National Tripartite Advisory Council. The council, which is the only body where labor, business and government meet to discuss policies, was formed on March 15, 2016.
That after 6 years, 5 and going into 6 years, there's absolutely not one piece of labor legislation brought to the parliament on behalf of the working class in this country. Absolutely none.
Mr. Roger said that while they were consulting on the council, thousands of workers lost their jobs at Petrotrin, the University of Trinidad and Tobago, and the Telecommunication Services of Trinidad and Tobago. The departure from NTAC by the trade unions came just one day after the council met. TTT News contacted Minister of Labour and Small Enterprise Development Stephen McClashy. He said while he was not shocked by the move, he was surprised because during Tuesday's NTAC meeting, Labour's representatives gave no indication of their intention. He called for them to return to the body, which he described as one of the most important instruments for the country, adding that Labour brought a wealth of experience to the council. The minister noted that while he agreed that there had been no new Labour legislation for the last 6 years, he gave his commitment to correct that situation.
So this year we are looking at actually bringing 3 pieces of legislation to the fore. That is the Industrial Relations Act, the Cipriani College of Labor Act, and we're also looking at the Severance Act and benefits. So those are pieces of legislation that are well in the advanced stages.
At the media conference, President of the National Trade Union Center, Watson Duke, advised that on Friday at 10 a.m., the 3 federation leaders would meet at the PSA to consult on the way forward for the local labor movement. Terry-Ann Brown-Campbell, TTT News.
Time now for sports. The dismissal of Sri Lanka batsman Doniska Gunethilaka has generated controversy. The left-hander was given out for obstructing the fields during Wednesday's Open One-Day International in Antigua. The incident occurred in the 22nd over of the Sri Lanka innings when the left-handed Gunethilaka, who had struck 55 off 61 balls, defended a delivery from captain Kiran Pollard just in front of the crease. Non-striker Pathum Nisanaka charged halfway down the pitch in search of a quick single but was set back by Gunethilaka, whose feet became entangled with the ball in an attempt to regain his ground, just as Pollard attempted to retrieve it, presumably in an effort to effect a run-out at the other end. Following Pollard's surprising appeal, umpire Joel Wilson ruled him out, and television umpire Nigel Dugrid subsequently upheld the decision, much to the astonishment of the batsman. Sri Lanka went on to be bowled out for 232 off 49 overs. And that's the news. Thanks so much for making it PBCJ. Remember, we are the People's Station.